So start with sitting on the chair, and then we'll get rid of the chair, and then we'll come back to it at the end. And this class is for men and for women. It's for pelvic health, and it's for a whole array of things. It's for difficulties passing water, difficulties using your bowels, sexual dysfunction and pain in intercourse. It's for, sometimes it's UTIs, urinary tract infections, can be just a very tight or unbalanced pelvic floor, tight adductors, tight hips, feelings of like just congestion in the pelvis, can all be due to imbalances in the muscles and over tightness sometimes. If you've got pelvic floor dysfunction, if you think about your pelvis as your pelvis, or SI joint problems, as your pelvis sort of rotates or distorts, all that's going to feed into your pelvic floor as well. So it's just something to keep an eye on. And the other thing is prostatitis. Sometimes if you've got prostrate pain, it can be just because of scar tissue, if you've had any sort of radiation, or just imbalance in the muscles. So it's just something to have a look at and just keep an eye on. So to start with, just put your hand on the top of your chest, your hand just under, sort of just above your belly button, and just breathe into the top hand. And then relax and exhale. So just do a couple of breath cycles. So it's quite common for us when we're rushing around to be breathing into the top hand, apical breathing. But for today, we're going to be focusing on breathing into using the diaphragm, using the belly. So see if you could breathe in now and breathe into the hand at the belly and not allow any movement at the hand at the chest. Exhale. I'm trying not to sneeze at the moment. Something is making me sneeze. So again, you're just going to breathe into the belly and try not to feel any movement in the hand at the chest. So as you breathe into the belly, the diaphragm is going to pull down, and that's going to push into your pelvic floor. So as you breathe into the belly, see if you could breathe into your pelvic floor. And then exhale. So you want to, you're not pushing with muscles, you're using just the breath to feel that little bit of pressure into the pelvic floor. So just using diaphragmatic breathing is a way to relax your pelvic floor. It's going to stretch it. Each time you breathe in, you're going to get that little bit of distension in the pelvic floor, and you're going to just start to relax some very tight muscles maybe. So if you think about your pelvis, you've got a rim at the top and you've got a rim underneath as well. Everything on that bottom rim is like a diaphragm of muscles, just like the diaphragm under the lungs. And you're just trying to breathe into that place nice and gently. Just feel that distension, a couple more. So we're going to keep this breathing going on through all the exercises that we do today. So you don't want to be feeling movement up here. You want to be feeling movement into the belly. As the diaphragm pushes down, it's going to push out the belly and all the organs in the abdomen. And it's also going to push down into the pelvic floor. Okay, so coming forward on your chair, we'll just do a vagal nerve release. We're just going to get our thumbs and we're just going to rub at the back of the skull. So we're just really switching on the brain. And while you're doing that oppositional rub, look up to the right, feel the stretch in the eyes. If you feel any tightness in the back of the skull, the rim of the skull, any sort of tight bands of muscle, you could just apply pressure. I found one on one side. Just apply pressure onto that point. And then when you're ready, you're going to look forward again, and then you're going to look to the left. If you wanted to, you could come slightly below the rim of the skull, or you could do two fingers, one above and one below the rim, and you could just do that oppositional massage. You're looking to the left. So you're just really stimulating, increasing blood flow to the brain, You're releasing and relaxing C1 and C2. And you're just really relaxing your neck as well. And then just looking forward and just relax. It just brings you into a more alert state. So scoot yourself forward on your chair, have your feet quite wide, and you're going to come forward and you're just going to put your elbows on the inside of your knees, and you're gently going to press out and just see how your hips feel, how your SI joints feel, how your low back feels. So this is a nice gentle way of stretching into what is our deep core line from our big toes through the calves, through the adductors, the inner thighs, into the pelvic floor, up through the spine, through the psoas, into the diaphragm, all around the heart, around the lungs, into the neck, into the throat and the tongue. So just focus on the breathing again. You're breathing in. Try and feel a little bit of pressure into the pelvic floor, and then as you exhale, you could relax. Breathing in. Breathing out. One more, breathing in. And breathing out. And just gently release your elbows inwards, hands on your knees, and just roll up through your spine. Just let your spine come out of that nice and gently. So even that feels quite strong. So we're going to take the chair away. We'll come back to it later. I'll leave it there. And we're going to grab our yoga block. And we're going to start with it in its tallest position. So that way is going to be lower. This way is taller. And you're going to put it on the floor. Make sure you've got nothing around you that you could fall over and bump yourself into. And you're going to sit on the yoga block, take your feet fairly wide, and just get used to this deep squat position. So this is a nice way of just allowing your hips, your SI joints, your low back, your pelvic floor, just to gently stretch. And also your adductors, your inner thighs, which can get chronically tight and cause all sorts of problems. So again, just focus on the belly breathing. You're breathing into the belly. And try and feel that little bit of downward pressure into the pelvic floor. Breathing out. So again, you're just breathing into the belly. So nice, slow, deep breaths. That's very calming to do this. And exhale. So this whole class is a really nice relaxation class, even though we're really addressing some very tight muscles. It's also very nice just to give yourself a little bit of time. Breathing out. So one of the big muscles in the pelvic floor is levator ani, A-N-I, which obviously are the strong muscles around your bottom. And you're sort of also feeling it into the muscles in the bottom. So between the front passage and the back passage, you just want to feel nice pressure. For guys, you'd be feeling it into the testicle area as well. For girls, just everything in general. So you could take those feet a little bit wider. You could also use a little bit of elbow pressure if that's comfortable. You don't want to go into extreme. You just want slight increase. You're using the belly breathing. Feel that little bit of downward pressure. Breathing out. Breathing in. So you're going to get a nice release in your low back doing this, and you're also going to get a nice stretch into the SI joints. If you've got SI joint dysfunction, just work within a comfortable range. Don't push your body, don't push those knees too wide if it causes pain. You're just going into what feels nice. So it's just slow, gentle breathing, giving yourself time. So you're spending a couple of minutes in each of these positions. So if you do tend to get problems in all those things that I've listed, just doing this, just sitting for a couple of minutes in a supported squat position is a really nice way just to stretch really everything through that sling underneath of you, even through the back of the legs, the hamstrings, the adductors, and just allow things to balance. Allow tightness in the back to melt away. So tight pelvic floors, or imbalance in the pelvic floor causes a whole array of symptoms that often get misdiagnosed. So if this feels okay for you now, it's up to you, you could stay as you are, or you could change the yoga block into the wider position, which is going to bring you into a little bit lower, so obviously stronger. So you might not have wanted to go straight into that, but after you've stayed in the higher position for a while, you might find that actually now you can do this and it doesn't feel quite so torturous. So you will notice your hips are stretching quite widely. You might notice your SI joints. And again, the belly breathing, you're breathing in. So using your diaphragm as you breathe is also going to be stabilizing your spine. Exhale. So maybe 3 to 5 breath cycles breathing in. Feel that little bit of downward pressure, just with the breath, not with muscles. You're not actively ever straining or pushing into the pelvic floor. That's completely the wrong thing to do. Just use your breath. So really, we don't need to do exercises to strengthen our pelvic floor. It should happen quite naturally with the breathing, with the diaphragm moving up and down and the pelvic floor reciprocating with that. So things like walking and squatting will strengthen your pelvic floor. So as you stand up from this position, you contract those muscles. As you walk, the pelvic floor is working. So just everyday functional movement should be enough to really start to strengthen your pelvic floor. We shouldn't be pulling our pelvic floor in all the time. So for years and years, we were taught to sort of pull in, suck in and pull up. That actually weakens the pelvic floor. It's not meant to be holding tight the whole time. So that was completely wrong as well. So just normal activities, keeping everything strong and in balance is enough to keep a healthy pelvic floor. So hopefully that's starting to feel a little bit more comfortable now. So just gently release those knees inwards, put your hands on the floor, and you could just slightly lift your bottom, and you could keep your feet at the width that they are, and maybe, I'll just move my yoga block, maybe just bend one knee and just give yourself a little bit of an inner thigh stretch, and then bend the other knee. So nice and gentle. I'm not going deep at all. It's just a little tiny knee bend, and I've got my toes pointing forward, and I can just feel from the feet all the way up the inside of the legs, just getting a nice stretch. And then to come out of this, you're going to just bend your knees, engage your abs, and slowly roll up through the spine. So, and when you've done that, just walk your heels and your toes in. So come to the floor, come to sitting. Grab your yoga block again. We're going to do the butterfly stretch. You're going to get your yoga block and you're going to sit on your yoga block. So you've got your soles of your feet together. You let your knees fall out so that it's like a butterfly with wings that open. Your toes are all matching up, and you're in an anterior tilt, which means you're not rounding, you're not slumping, you're hinging at the hips. So if you think of your breastbone coming forward, or you could think of your belly button coming forward, very straight back. And that way you keep the stretch in the pelvis and the hips, but you don't push tension into the back. If the back is rounded, it's all going to jump into the back. And you're probably quite tight in the back anyway if you've got some sort of dysfunction in the pelvis. So you're going to just move your belly button forward. Feel like your sit bone and your tailbone swings to the back. So that's an anterior pelvic tilt. You could put your elbows against your knees, and you're gently going to just push the knees down towards the floor. And you're looking straight ahead. You breathe into the belly, breathe into the pelvic floor. As you breathe out, just relax. So again, breathing into the belly, breathing out, relaxing into that stretch. Every time you breathe out, you're going to move a millimeter or so more into this stretch. Breathing into the belly. As you breathe out, relaxing into the stretch. You could drop your head as long as you don't round your spine. So don't go into a slump. So if you want to, you could breathe into the belly. As you breathe out, you could just drop your chin to your chest. You're just using the weight of the head in the stretch. Breathe into the belly. Breathing out, relaxing into the stretch. You've got a choice. You could come out of it if you want to every now and again, and then go back into it if you're finding it really, really strong. Or if you feel like you are loosening up, you could just stay in it. Breathing into the belly. And as you breathe out, you could add a little bit of a downward press with your elbows. Make sure you're not rounding the spine, so pushing forward through the heart. You don't want to feel any tension in your spine as you do this, just in your hips. Breathing in. As you breathe out, gently pressing elbows into legs, relaxing into the stretch. I'm going to do one more breath cycle, breathing in. As you breathe out, just feel like your hips, your low back, your SI joints are just relaxing into this stretch. And then just gently ease out of it, come back. And you could just wiggle your knees and just see, or you could move them with your hands and just relax anything that feels a little bit tight. Move my instructions over to this side. So scoot yourself off the yoga block. And we're coming into feet together. We're going to roll down to the floor and make sure you've still got your yoga block around. If you're in the diamond, but now in a prone position, if you feel uncomfortable with this, you could always prop your knees up with cushions or yoga blocks. If you've got two, you could put one either side and just support the knees. I'm just trying to get it so that you can feel more comfortable. So you could put two really big cushions either side of your knees and just let your knees feel more supported in this. So it's not such a strong stretch. I'm going to take the block away because I don't actually need it. But if you wanted to, big cushions under the thighs or two yoga blocks, and you're going to put your hand on your belly again. So one above the belly button, one below the belly button. And you're just going to breathe into the belly again. Breathe into the pelvic floor. Breathing out. So, you know, if you just pick one of these exercises, you could do this one for about 5 minutes. Just relax on the floor. Breathe into the belly, breathe into the pelvic floor, breathing out. So you notice each time you exhale, that reflex in the muscles just releases slightly and you go deeper into the stretch. So it's PNF stretching. Proprioceptive neuromuscular facilitation, using the reflex in the muscles. So you're breathing in, into the belly, into the pelvic floor. Just feel that little bit of downward pressure into the pelvic floor. As you breathe out, the muscles relax and let go. Breathing into the belly. So if you were just feeling a little bit stressed and you just needed a little bit of downtime or a little bit of you time, you could do this for 5 minutes. You could relax your body. You could bring yourself into your parasympathetic nervous state where you feel very relaxed and calm, and you could release and relax and balance your pelvic floor, your deep core line. And so it's a very nice relaxing thing to do, but it's also very effective. So we do it again, and you might be noticing by now, you might be feeling that deep core line from the big toe through the calves, through the inner thighs, into the pelvic floor, up through the spine, through the psoas, into your diaphragm. You can feel everything really starting to stretch now. Breathing out, so you're just using the breath, you're using gravity, you're using PNF, that natural reflex in the muscles to let go on the out breath. Last time, breathing in, as you breathe out, just relax, melt, So to come out of this is quite strong stretch. Just put your hands at your outer thighs and just gently assist your knees and bring them back in together again. And then bring your knees into your chest and just give yourself a little squeeze. So you're just relaxing, releasing that tension in the inner thighs. And just for the spine, just bring your head into your knees, pull your shins towards your ribs. So mid shins, pulling into rib cage. Just get that nice deep back stretch. Take a breath into the back of the rib cage, the low sides. So still belly breathing. And as you exhale, gently come down through the head. So a nice thing to do is to hold your shins and just start to roll your knees from right to left. So you're massaging your back, but you're also, your knees are about the width of your body, or maybe even a little bit wider. You start to notice your inner thighs, your pelvic floor again. So you could turn that into sort of a circle. So imagine you're stirring a pot. So it's not just your inner thighs and your pelvic floor. You can feel your back muscles, your SI joints, obliques, abdominal muscles, all part of this, but just a really lovely movement. And you're massaging your back muscles into the floor. You could turn this into a sort of a figure of 8. So as your body relaxes into this, you could put your hands on the inside of your knees and just not really pressing, but just the weight of the hands is increasing the stretch. I've gone back into circles. So you can feel the weight of the hands translating down the femurs into the hips. Go the other way. So bring your feet together, slide your hands down the inside of your calves. You're holding just above the ankles and you're using your elbows to push your inner knee outwards and downwards. So you're increasing, again, you're increasing the stretch.